in whatever ways that I can. This will be the 10th round of the Syringe Access Fund, and we are very excited to be able to continue this important and critical initiative. At this time, I'd like to remind everyone that the webinar is being recorded and that it will be posted to our website. This will allow you and others who might not be on the call to refer to it in the future. We ask that everyone mute your phones and computers so that we get the best recording quality possible. If at any time during the webinar you have questions for us, you can submit these questions using the Q&A box in your webinar window. On today's webinar, we're going to go over a few things. The agenda includes a brief overview of AIDS United and the Syringe Access Fund, eligibility and grant requirements, steps for how to apply, the attachments you'll need to include with your proposal, the application and grantee selection timeline, and then we'll open it up for Q&A. So, AIDS United, our mission is to end the AIDS epidemic in the United States through strategic grant making, capacity building, policy, technical assistance, and formative research. AIDS United is a national nonprofit organization with a singular mission and focus to end AIDS in the United States. At AIDS United, we lead the charge for responsive and effective federal, state, and local policies that benefit people living with and at risk for HIV. We invest in innovative models to meet the needs of communities affected by HIV and AIDS. We have given more than $104 million in direct funding and leveraged $117 million to increase capacity of communities and organizations responding to HIV in the United States. We inform the field with best practices and lessons learned. We advance advocacy based on sound public policy, strategic grant making to affected communities, targeted and tailored capacity building for organizations responding to the epidemic, and research and evaluation to inform the field. We work within a social justice framework that challenges the foundational issues of racism, sexism, homophobia, and transphobia, socioeconomic inequality, gender discrimination, and stigma. As Paula mentioned earlier, the Syringe Access Fund is a funding collaborative of AIDS United, Elton John AIDS Foundation, Levi Strauss Foundation, Open Society Foundation, and the H. Van Ameringen Fund that was created in 2004, and it makes up 25 to 33% of all private funding for syringe service programs in the United States annually. Since 2004, the Syringe Access Fund has provided more than $17.7 million in cash grants and technical assistance to directly support syringe service programs and advocate for effective policies that address HIV and viral hepatitis transmission among people who inject drugs and their sexual partners. In more than 10 years of grant making, the staff has made remarkable impact on public policy and public health, providing 289 grants to 146 organizations in 32 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. Just to give you a little recap of what we've accomplished in round 9, the first year of the round 9 grant cycle, we have 58 grantees. 51 of those are programmatic grants, 7 of them policy. And our grantees have collected over 3.6 million syringes, and they've distributed over 25.7 million. And they've logged 110 participants. So as you can see, the Syringe Access grantees that we currently have are doing some really amazing work. The Syringe Access Fund provides grants to support work in 2 key areas. 1, Syringe Access Direct Services, which provide access to sterile syringes through syringe services programs. And 2, education and mobilization, which are policy and advocacy campaigns focused on improving public policy at local, state, and/or national levels. Please note that organizations can apply to either area, but they cannot apply to both. The primary goal of the Syringe Access Fund is to provide core support for programs that demonstrate either an ability to provide high-quality syringe access services to one or more identified populations, and/or an ability to conduct local, statewide, or national level policy advocacy initiatives that demonstrate concrete objectives and activities to expand access to sterile syringes. The staff will prioritize support for programs in geographic areas in which access to sterile syringes can be dramatically improved through either greater programmatic capacity or policy improvement. Other compelling factors may include HIV and hepatitis C prevalence, injection drug use prevalence, opioid use, overdose incidence, availability of local funding, and areas in which policy improvements can have local, state, and/or national impact. I'd like to take a moment to discuss meaningful involvement of people with HIV and AIDS. At AIDS United, we would like to extend this concept to the meaningful involvement of people who use drugs. MIPA, as it's known, stems from a concept of GIPA, or the greater involvement of people with HIV/AIDS. GIPA means meaningfully involving people living with HIV in the programmatic, policy, and funding decisions and actions that impact their lives by ensuring that they participate in important decisions. MIPA affirms that people living with HIV must be involved in decision-making at all levels, their own health, and how organizations serve them, and how their communities and nations respond. MIPA recognizes the important contribution people living with or affected by HIV can make in their response to HIV and helps create space within society for the involvement and active participation of people living with HIV in all aspects of that response. The Syringe Access Fund will prioritize support for programs that meaningfully involve drug users in designing, delivering, and evaluating services, as well as programs that are peer and volunteer run. The Syringe Access Fund strives to increase leadership among people who use drugs. The staff will mirror MIPA principles with the expectation that people who use drugs must be involved in decision-making at all levels of this project. For more information on meaningful involvement, you can view the MIPA document in the download section in the bottom corner of your screen, or you can click on the download at ageunited.org/resources. Oh, it's not a click on. You can visit that website and download it from there. It's a free resource. Okay, so eligibility and grant requirements. Applicants must be nonprofit, tax-exempt organizations per the guidelines set forth by the IRS. Appropriate verification of this federal status must be provided. Organizations that do not hold 501c3 status may apply through a fiscal sponsor. The staff will support work within the 50 states, the District of Columbia, Native American reservations and tribal land, the U.S. Virgin Islands, Puerto Rico, and any other U.S. territory. New applicants, as well as applicants and grantees from previous Syringe Access Fund grant cycles, are welcome to apply. Organizations may submit only one application for consideration in either the Syringe Access Direct Services category or the Education and Mobilization category. Organizations that wish to apply in the Direct Services category can be existing or startup syringe services programs. The grant period for Round 10 will run from February 1st, 2018 through January 31st, 2020, with programmatic and financial reports due at the end of each grant year. Second-year payments are conditional based on first-year progress, outcomes, and compliance. The total amount of funding available for this round is approximately $2 million. Maximum awards in both funding categories will be $75,000 total, divided equally over 2 years. A single organization applying on behalf of multiple smaller agencies may be approved for a slightly higher amount on a case-by-case basis. The staff encourages government support of syringe access. In places where local or state government can find resources for syringe access services, education, or mobilization, the staff may be willing to provide matching funds to advance these efforts. Governmental organizations will have up to 1 year to secure the matching funds. Grant dollars for governmental organizations will be dispersed at the end of year 1 after January 2019. Matching fund verification is required for government agencies. The matching component provides an opportunity for public and private innovation. For example, this may mean that SAP resources would be used to purchase syringes while public dollars support other aspects of syringe access programming. When you're working on your application, we ask that you please keep your responses in the narrative and description of request portion to the equivalent of 5 single-spaced pages of 12-point font in a word processing program such as Microsoft Word. Be clear and thorough in your responses. Anticipate questions the review committee might have. Don't assume they know your organization and your work. This year, we are pleased to announce 3 ways to apply for funding. The first is the traditional submission of a written application through our online grants management portal, Foundation Connect. Completed proposals, including all attachments, are due via Foundation Connect no later than 5 p.m. Eastern Time on Friday, November 10th of 2017. All components of your application must be submitted by this time. If the application is submitted with any components missing, it will be deemed incomplete and will not be considered for a grant award. Application materials will not be accepted through email, fax, mail, or express delivery. The second option for submitting an application is the Skype conference call. If you'd like to schedule a Skype conference call submission, you should email staff@ageunited.org no later than 5 p.m. Eastern Time on Friday, October 13th. The third option is a video application. The completed video must be submitted no later than 5 p.m. Eastern Time on Friday, November 10th, 2017. All attachments must be submitted at this time as well. And we will go into more information on these new ways of submitting proposals in just a few minutes. When you submit your application, there will be several attachments that are required. The first is your 2-year project budget. Organizations must use the Age United project budget template, which you will find in the Files box, as well as online and in the Foundation Connect portal. The project budget should include all expenses and income for activities beginning in February 2018. Please fill out the yellow fields in all 3 tabs of the workbook. Do not use any budget form other than the one provided by Age United. The project budget must be submitted in Excel format. The second attachment is the organization's current annual operating budget. This must include expenses and income. We ask that this be submitted as a PDF. Third is your most recent audited financial statement, including cover page and the auditor's notes and findings. If your organization does not have audited financial statements, please send your fiscal agent's audit. If your organization does not have a fiscal agent or an audit, please submit your IRS Form 990 for last calendar year. If you do not have any of these documents, you must provide a detailed letter of explanation. The audit or the 990 must be submitted as a PDF. Fourth, a list of you or your fiscal agent's board of directors with professional or community affiliations. If your organization does not have a board of directors, please send your fiscal agent's list. If neither is available, a letter of explanation is required. We ask that the board of directors list be submitted as a PDF. Next, any memoranda of agreements or letters of support should be uploaded to the system or emailed to staff@ageunited.org. We ask that these also be submitted as a PDF. And last, a completed diversity table. The diversity table template is located in the Files box. You can also find it on our Age United Syringe Access Fund website, as well as in the Foundation Connect Grants Management portal. We ask that you please fill out the table and answer all questions located on the second tab of the workbook. the diversity table must be submitted in Excel format. So first we will review how to submit your application through the Foundation Connect Grants portal. The first thing you'll want to do is go to the Syringe Access Fund webpage. You can find a link under the web links box at the bottom of your screen. You can also get to it just by going to Age United's homepage. Once you get to the SAF webpage, you want to click the Apply Now button or the Start Written Application button. This button will take you to the application's eligibility quiz, which is a series of 3 questions to determine the organization's eligibility. Once this quiz has been taken, if you pass the eligibility quiz, you'll be taken directly to the Foundation Connect login page. If you do not pass the eligibility quiz, you will be redirected back to the Syringe Access Fund webpage. As I said, if you pass the eligibility quiz, you will come to this page. If your organization has ever used the Foundation Connect system to apply for a grant through Age United, or if your organization has used the system to submit reports, then your organization will have an existing account. Please be sure to use those login credentials. If you are not sure you have a login, please email me at saf@ageunited.org. If you know your username but can't remember your password, click the Can't Access Your Account link to reset your password. If your organization has neither applied for a grant nor submitted reports to Age United using this system, click Register to create a new account. Before doing so, be sure to bookmark the login page. Once you have created an account, be sure to save your username and password so that you can return to your open application. Once you've logged into your account, you can work on your application as many times as you'd like. Just save your work before you log out. Here is the screen that you'll see once you log in. You can ignore the top row here that says Submitted. What you'll see before you submit your application is the request type will say SAF Round 10. The status will say either Application Invited or Application Started. And in order to edit it, you'll want to click on this little pen and paper icon at the left side of the screen, and this will bring up the application for you to edit. A few tips for using the Foundation Connect Grants portal. Please use Chrome or Firefox to access Foundation Connect. Frequently, users experience issues with Internet Explorer, particularly older versions of Explorer, not loading Foundation Connect. You are able to save your application so that you can work on it in phases. However, you have to enter text into all of the required fields in order to save the application or view the Attachments tab. If you hit Save, but there is not text in all of the required fields, the application will not save. You can enter text or a single character or number into all the required fields in order to save the application before all of your narrative is complete. Hit Save often once there is text in all required fields, as the system will automatically log you off if too much time passes. We strongly recommend completing your narrative in a Word document, then transferring it into Foundation Connect for 2 reasons. Sometimes web browsers crash or Foundation Connect will time you out and you will lose anything that has not been saved. Microsoft Word will also allow you to monitor the page count. When you paste into Foundation Connect, please paste as plain text into the system. Any HTML formatting, such as bullet points, bold, or italics, gets converted to HTML tags in Foundation Connect, which will count against your word count in the system. Next, we have the Skype conference call option for submitting a proposal. As I said earlier, applicants must email saf@ageunited.org no later than 5 p.m. Eastern Time on Friday, October 13th to schedule a Skype conference call submission appointment. These conference calls will last approximately 1 hour. All Skype conference calls will be recorded to serve as backup, as well as used as a tool for applicants to receive feedback. Applicants should be prepared to respond to all application questions. General organization and client information will be collected through a Qualtrics survey. The link to the Qualtrics survey is located in the web links box. This survey must be completed before your scheduled Skype conference. After the Skype conference, applicants will be sent a written summary of the call for their review, edits, and approval. Applicants will have 3 business days to edit, correct, and return the final version, acknowledging that it accurately reflects the information provided during the Skype conference. Skype applications must submit the required attachments described in the Financial and Other Attachments section via email to staff@ageunited.org no later than 5 p.m. Eastern Time on Friday, November 10th, 2017. As I said earlier, any applications that do not submit all attachments by the deadline will be deemed as incomplete and will not be reviewed. And the third option for submission is the video application. Organizations applying using the video submission option will video record their responses to all application questions. General organization and client information will be collected through the Qualtrics survey. Again, the link to the Qualtrics survey is in the web links box. The link to the Qualtrics survey can also be found in the RFP that you can download from Age United's website. This survey must be completed no later than 5 p.m. Eastern Time on Friday, November 10th, 2017, the same deadline for the video application. Responses should be given in the order the questions are asked in the RFP. The applicant should make it clear to the reviewer which question is being answered. The finished video cannot exceed 1 hour in total. Videos should be sent to staff@ageunited.org via Dropbox or another method that can handle the transfer of large files. Do not send your video as an email attachment. When planning your submission, please allow ample time for your video to upload completely before the deadline. Video submissions will be sent to the review committee as submitted, and reviewers will be instructed to stop watching all videos at the 1 hour mark. Video submission applicants must submit all required attachments described in the Financial and Other Attachments section via email to staff@ageunited.org no later than 5 p.m. Eastern Time on Friday, November 10th, 2017. Here we have an application and grant timeline chart. As you know, on September 15th, we released the RFP, and today, the 26th, we're having our first TA webinar. We'll have another one on September 28th. Skype conference call submission requests must be sent to staff@ageunited.org no later than 5 p.m. Eastern Time on Friday, October 13th. Applications are due no later than 5 p.m. Eastern Time on November 10th, 2017. We highly recommend submitting your application early to avoid or address any issues with technology. All components of the application must be submitted by the November 10th deadline, including all attachments. Approved applicants will be notified of funding on December 18th, 2017. Applicants that are not funded will receive written notification in February of 2018. We request that applicants not ask for notification before this February date. Please do not call or email about the status of your application during the review process. Now we are going to open up the line for questions. We ask that you please submit your questions using the Q&A box on your screen.
We have a few questions in queue, so I will read the question out loud and direct them to Zach and Paola. And while we are answering these questions, please add your questions to the Q&A box. The first question we had come in was, are public health departments eligible to apply for Syringe Access Direct Services funding if they can't secure this funding elsewhere?
Yes, the public health departments can, but there is a match requirement. So that's a challenge, but that is a requirement for the health department.
Thank you. Our next question in queue, just to clarify, you are willing to consider applications from organizations that do not currently operate syringe service programs but are looking for funds to start up?
Yes, we are. They're accepted. It will be a competitive process, so you will have to show that you're ready and able to use these funds properly and be effective in the community. But yes, the applications will be accepted.
Currently, those were our only two questions in queue. We will wait for a few minutes as other questions come in. As a reminder, you can use the Q&A box in the bottom right-hand side of your screen to type a question to us. We have another question. Does the public health department need to be a 501c3 to apply?
No, they do not. The public health department would fall under the government agency criteria, so they would have to provide the matching funds, but they are still eligible to apply.
Thanks, Zach. Our next question is overhead limited to 15%? I'm assuming this is in relation to an organizational budget.
I think so. It's in the project budget workbook. There's a line item for indirect costs, and I believe that is set at 15%, yes.
Well, we can confirm and send that out.
Our next question, how do we answer the narrative for new programs given that it is primarily geared towards existing programs? The questions are primarily geared towards existing programs.
You answer, we can talk, you can give a call and we can kind of talk through that, but that's the information that the reviewers are going to be looking for, like how prepared and able are you to use these funds appropriately.
Next question, how do you anticipate the distribution between categories? So that would be between direct service or advocacy. Are you looking to make a certain number in either category?
We don't know how that's going to be, how that's going to come out. It depends on the applications that come in and how the review goes. So that's not something we're going to know ahead of time.
Next question. Our timing is a little odd. We are looking to fund a program in a neighboring county that is in the process of legalizing syringe access programs at the BOH, which I'm sorry, I don't know what BOH stands for. We'd still like to apply to demonstrate the viability of the program. Does that make sense?
I think you could still send in an application. It would depend on the consideration that you explained it. But just be clear in your proposal, what is the status? There may be a question, a follow-up question to get an update on how that is, and that might be taken into account into the final decision.
We're getting a lot of great questions here. All right. All right, next question. What funds cannot be used to start up a program? Oh, excuse me, they sent in a typo. What funds cannot be used to start up a program?
I guess I'm not sure of the question. They can be used to start up a program. It just depends how competitive they'll be in the review, because we expect a high demand, and unfortunately, $2 million sounds like a lot, but it's not able to cover all the need, unfortunately.
We're getting a lot of questions regarding new programs. We have another one. For new programs, what is a reasonable startup period from receipt of funds to beginning of service delivery?
That's a good question, which I don't think you probably have a better idea to tell us what would be the reasonable startup period from your perspective. Again, just put as much information in the proposal as you can.
Next question. May we create an FTE or PTE, full-time or part-time positions with this funding?
Yeah. Yes,
Yeah.
that's absolutely possible.
Thanks. All right, we're just going on through. For public health departments, would funding being used for opioid coalition work or education count as match? If so, the funding from AIDS United could be used to purchase syringes?
I'm not sure. We'll look into that and get back to you on that question, but that's a great question.
So for the person who asked that question about public health departments and the opioid education, please email us at staff@aidsunited.org. We also have your information here, so we'll follow up with you. Next question. We are a public health department, but we also have a 501c3 arm to our organization. May we apply with our 501c3 acting as our fiscal agent?
Again, that is a technical question. That sounds right to me, but I would rather check on that and again get back to you with the proper information.
All right, so for the person who asked about your 501c3 for your health department, please email us at staff@aidsunited.org. We also have your information, so we will follow up with you directly. All right, next question. If there are future questions about the application, to whom should they be directed? Faith, do you want to take that, Zach?
Yeah, so we ask that all questions be sent to staff@aidsunited.org. You can direct them to me in the email line. I'll primarily be the person responding to those, but in the event that I am out for a day or something, we want to make sure that Paola also has access to those questions. So please email them to staff@aidsunited.org.
Next question. Is the call chick survey required just if you are applying via Skype or video, or is it also required for the traditional RFP in Foundation Connect?
It's only required for the Skype or video application methods.
Those questions are answered through the Foundation Connect portal.
All right, we've gotten another clarification question on the startup. Are there areas or things that the funds cannot be used for in the startup period for a program?
We have not set any guidelines on that. We don't have any guidelines to offer there.
If you have more specific questions afterwards, please email us at staff@aidsunited.org. All right, next question. For existing syringe access program that does not have dedicated funding but operates within an agency with a large budget, do you have advice for differentiating between the operating budget versus agency budget in the application?
That's a great question.
So in this question, there's two documents that you will upload in terms of budget. One is the organization's overall operating budget. So we'll need that for the entire agency. The project budget includes one column where you will put in the money that how you would use the funding from the Syringe Access Fund. There's another column where you'll put in your total budget for the project. So it sounds to me like that is where you would put in these additional funds that for your syringe access program. So there's space within the project budget to include that.
We had a clarifying question about the email address. It is S as in syringe, A as in access, F as in fund, SAS@aidsunited.org. I have also added it in the audio information text box. And you'll find that email address all over the RFP and the website as well. We have another question about if there's a deadline for questions.
No, just send them in. I mean, just keep in mind the deadlines for the proposals.
No questions past November 10th.
That's all of the questions that we currently have in queue. Any other questions? We'll take a few minutes to have them trickle in.
And I want to the folks who have been asking about government agencies and startups, I know that that's kind of a lot of technical stuff going on there. So like we've said, after this, in the next week or so, please reach out to us via email. We'd be more than happy to talk to you about what that could potentially look like. And by then, we'll be able to respond to these questions a little bit better.
All right, we have another question about the application length. For written narrative, 5 single space pages in 12-point font?
Yes.
That was an easy answer. We'll take another minute.
And I would also encourage everyone to download the RFP from the website or from the files or web links box. Most of this information is in the RFP. So if you read it from front to back, you'll have a very solid understanding of everything that we've talked about today. So I do strongly encourage you to give that a read.
We don't have any other questions in queue. I do want to take another minute to see if anyone else has a question. At this time, I'll share with you all this webinar recording will be available online on the RFP website page, along with the slides that you can reference. And we will have another webinar with the exact same content on Thursday of this week. And the information for that webinar is on the RFP page if any of your colleagues or if you would like to sit in on this webinar again. We have a question. Do you have a printer-friendly version of the application?
The application itself, the questions are in the RFP. So if you download the RFP, you'll have all of the application questions.
And it's a PDF, so you can print that pretty easily.
Yes. And I want to take a moment. Let's see, I have one more slide here. Once this webinar is over, as I said, if you have additional questions or you're following up on questions that we weren't able to answer today, please contact us at saf@ageunited.org. You can also contact me directly by phone at 202-876-2836. I also just wanted to let everyone here know I will be out of the office from October 11th through October 23rd. So please email saf@ageunited.org if you have questions. I'm getting married and I will not be responding to email for a while.
All right, I think that concludes our webinar. Someone sent in a mazel tov via the comments. Thank you. We're very excited for him too. That concludes our webinar. We will post this recording online, and then we also are doing a webinar again on Thursday. If you have any questions, please contact us at saf@ageunited.org. Thank you all.
Thank you.